Mr. Joseph has an order for wound care and colostomy care. I have gathered all of my equipment and I've washed my hands, and I come into the room and do all the preparations for the patient. I'm going to go ahead and clean off the table with a wipe. And while I'm doing that, I am going to go ahead and explain the procedure to the patient. I'm going to wipe the entire table off with the antiseptic wipe and the table edges and let that dry for a minute while I make sure that the patient has all the information they need about the procedure that I'm going to do and make sure that they don't have any questions. Then I'm going to take the equipment out that I need for completing wound care. I'm going to take that out, and the first thing I'm going to do is I'm going to go ahead and put a blue pad down, protect my bed, and I'm going to get the bag ready for any of the garbage that I need. And I'm going to go ahead and set up my sterile field. I'm going to take my sterile gloves and open them, and I'm going to use the sterile glove package as my sterile field that I need for all of my equipment. Open these up. And make sure that stays open. I'm going to need an ABD pad for the top of the wound. I'm going to open that up. Get on the sterile field, cover my arm, and put it down on my sterile field. I'm going to use a 4x4 and open that up. Put that down on my sterile field. And I'm going to need some split gauze, which I will open again and put on my sterile field. And then I'm going to need some pickups or tweezers, so I'm going to open those up. And place those down on my field. And then I'm going to need one sponge on the side that has two in it to clean the wound with. I'm going to open that up along the side so I can put some solution on it. Make sure that that stays open. Then I'm going to go ahead and wash my hands with some hand sanitizer. You can use a sink if you have one available. And I'm going to put on a pair of clean gloves. And I'm going to go ahead and take off the old dressing. Once I have my clean gloves on, I'm going to go ahead and take the old dressing off. I'll take the JP out off of the dressing where it's hooked on and put it to the side. Then I'm going to go ahead and remove the old dressing, the tape off, and I'm going to take off the first layer and assess that for color, odor, amount, etc. And then the 4x4 and assess that, and then take off the split gauze and assess each one of those. When I finish getting off the dressing, the wound, I'm going to assess the wound itself as well as the JP site to see, any kind of the status of that. Then I'm going to go ahead and take off my clean gloves and get rid of those. I'm going to go ahead and wash my hands, and I'm going to go ahead and get the irrigation solution that's ordered ready. I'm going to go ahead and pour a little bit of that onto my 4x4 so I can clean the wound. And then I'm going to go ahead and prepare my tape and get that ready as well, so that it's ready to go for to tape the wound when I'm finished. On one of the pieces of tape, I'm going to put my date, time, and initial. Get that all set up so it's ready to go. Okay, once I'm finished with all of that, I'm going to go ahead and start the sterile procedure. So I'll wash my hands, make sure they're clean, and I'm going to go ahead and begin by gloving. Take the first glove out, pick it up away from my field, go ahead and put the first glove on, and I'm going to go ahead and get my second glove. Glove up. And then I'm going to go ahead and clean the wound. I'm going to pick up my forceps or my pickups and get the one of the 4x4s off of my two here. And I'm going to wipe the wound from top to bottom. Down. I'm going to get rid of that 4x4, and then I'm going to pick up my second one that's moistened, and I'm going to make one wipe around the JP tube at its entrance and get rid of that and the pickups. Then I'm going to go ahead and take my split gauze, there should have been two in the package. I'm going to take one of them, and I'm going to place it around the JP tube, and I'm going to take the other one and place it at a different angle around the JP tube. Take my 4x4s, place them on top of that, and last of all, my ABD, and place it over the top of the entire wound. Take my tape, and I'm going to tape it down to the patient. Tape down the best I can. Once I'm finished with that portion of it, I'm going to go ahead and remove these gloves. I'm going to wash my hands again with the hand sanitizer and take a second pair of clean gloves, and I'm going to go ahead and take care of the JP tube, emptying that into and measuring it and assessing the content of that. So I'm going to take a measuring device, and I'm going to go ahead and open it up and get it ready. Open up the little opening on the top where the JP opens. Get that out, and I'm going to empty the contents into a measuring receptacle.